Thank you very much. Thank you. It's beautiful out here this time of year. In the past 9 months, my administration has initiated the single greatest mobilization in U.S. history, pioneering, developing, and manufacturing therapies and vaccines in record time, numbers like nobody's seen before. No medical breakthrough of this scope and magnitude has ever been achieved this rapidly, this quickly, and we're very proud of it, and I had tremendous help from the military, generals, admirals, and many of the great people at the White House. Operation Warp Speed is unequaled and unrivaled anywhere in the world, and leaders of other countries have called me to congratulate us on what we've been able to do, and we've helped many countries with their ventilators and all of the problems they were having, and I'd like to congratulate everyone involved in this effort. It's been an incredible effort. As a result of Operation Warp Speed, Pfizer announced on Monday that its China virus vaccine is more than 90% effective. This far exceeds any and all expectations. Nobody thought they'd get to that level. And we have others coming which we think will be at equal level, maybe more if that's possible. In July, my administration reached an agreement with Pfizer to provide $1.95 billion to support the mass manufacturing and distribution of 100 million doses, with the option to purchase a total of 600 million doses shortly thereafter. Our investment will make it possible for the vaccine to be provided by Pfizer free of charge. Pfizer said it wasn't part of Warp Speed, but that turned out to be an unfortunate misrepresentation. They are part. That's why we gave them the $1.95 billion, and it was an unfortunate mistake that they made when they said that. We will work to secure an emergency use authorization, which should be coming down extremely soon, and my administration will then coordinate the distribution of the vaccine, and it will be approved. I think, again, it will be approved very, very quickly, we hope. The average development timeline for the vaccine, including clinical tests and manufacturing, can take 8 to 12 years. Through Operation Warp Speed, we're doing it in less than 1 year. If you had a different administration with different people, what we've done would have taken, in my opinion, 3, 4, 5 years, and it would have been in the FDA forever. This is 5 times faster than the fastest prior vaccine development in history. 5 times faster. Say it again, 5 times faster. Nobody can believe it, actually. 3 other vaccines are also in the final stages of trial. They'll arrive within a few weeks, and they will also be mass-produced, and the delivery will be very rapid. We're ready to go. The vaccine will be distributed to frontline workers, the elderly, and high-risk Americans immediately. It will be a matter of weeks. Get out very, very much ahead of schedule. Any schedule that I said we're going to be far ahead of that. We know that this virus primarily targets older populations and those with underlying health conditions, while over 99.98% of those under the age of 50 make a full and quick recovery. By giving the vaccine to high-risk individuals right away, we will dramatically reduce hospitalizations and deaths. Case levels are high, but a lot of the case levels are high because of the fact that we have the best testing program anywhere in the world. We've developed the most and the best tests, and we test far more than any other country, so it shows, obviously, more cases. By vaccinating the elderly and the high risk, we will effectively end this phase of the pandemic and allow seniors to reclaim their golden years, the golden years of their lives, which is so incredible. And it's about time that they can have those golden years. Again, this process is starting right away. Millions of doses will soon be going out the door. They're all ready, waiting for that final approval. As soon as April, the vaccine will be available to the entire general population, with the exception of places like New York State, where, for political reasons, the governor decided to say, and I don't think it's good politically, I think it's very bad from a health standpoint, but he wants to take his time on the vaccine. He doesn't trust where the vaccine's coming from. These are coming from the greatest companies anywhere in the world, greatest labs in the world. But he doesn't trust the fact that it's this White House, this administration. So we won't be delivering it to New York until we have authorization to do so. And that pains me to say that. This is a very successful, amazing vaccine at 90% and more. But so the Governor Cuomo, will have to let us know when he's ready for it. Otherwise, we can't be delivering it to a state that won't be giving it to its people immediately. And I know the people of New York very well. I know they want it. So the governor will let us know when he's ready. He's had some very bad editorials recently about this statement and what's happened with respect to nursing homes and his handling of nursing homes. And I hope he doesn't handle this as badly as he's handled the nursing homes. But we're ready to provide it as soon as they let us know that they'll actually use it. And again, it's a very safe and a great vaccine. Already we have among the lowest case fatality rates, our country, anywhere in the world, the entire world, and we've performed significantly better than our peer countries. As far as therapeutics are concerned, my administration's also made critical investments in therapies that have helped reduce the mortality rate by 85%. That's, to me, one of the most exciting things. It's incredible, some of the antibody vaccines and others that have come out and have really helped people. 85%. Last month, the FDA approved remdesivir, and we've secured enough remdesivir to treat 850,000 patients. My administration finalized an agreement with Eli Lilly to purchase the first doses of their antibody therapy, which shows amazing results. This treatment will be available completely free of cost to patients. 5,000 units have already been shipped, and many more are going out the door as we speak. We've also reached an agreement with AstraZeneca for the large-scale manufacturing of their antibody treatment, which is excellent. We expect to issue emergency use authorizations for a number of additional treatments in the near future. Tremendous promise, but remember the 85% number. That's an incredible number, but we have some tremendously promising drugs online and ready to come out. We have ensured that our frontline workers have all the tools they need. My administration's invoked the Defense Production Act and related authorities over 100 times and have made a historic investment into our industrial base. All states that requested PPE from the federal government have received the PPE almost immediately upon request. Every American who needed a ventilator has had access to a ventilator. Think of that. Very complicated piece of equipment, very expensive. And we haven't had one person in this whole country that has requested or needed a ventilator that hasn't had it. Every single request has been immediately filled. So that was something that was a great job. And now we're helping the rest of the world with ventilators because it's a very hard thing. We're producing them thousands of ventilators a month. The federal government has 22,000 beds immediately available for states and jurisdictions that need additional capacity. But we think that it's going to start going down, possibly very quickly. We'll see what happens. But with the vaccine, you'll see numbers going down within a matter of months, and they'll go down very rapidly.
While the rest of the country has been counting votes, an Army general named Gus Perna has been counting doses of vaccine. He's in charge of Operation Warp Speed, the catchy title given to the crash program to inoculate 300 million Americans against the coronavirus by next spring. For those of you longing to reclaim a semblance of your previous life, it may not seem all that speedy, but it is compared to the 5 to 10 years it usually takes to field a new vaccine. Once approved, it will not be a silver bullet. Just as with the annual flu shot, some of us will still get sick. But it should make enough people immune so that the virus runs out of places to go. That would give this country what it badly needs right now, a shot in the arm.
So if this distribution of vaccines doesn't go according to plan, where does the buck stop?
Me. Conversation's over. It's pretty easy. Me. I hold myself 100% personally accountable to that end.
On his whiteboard is one possible scenario: the all-important approval by the Food and Drug Administration of a vaccine developed by Pfizer, followed by approval of another from Moderna.
What is D-Day?
The day that we deliver the first round of vaccine.
What is D-Day?
The day that we deliver the first round of vaccine. for Pfizer.
That's when it would start to get complicated because if approved, the Pfizer vaccine will require patients to receive 2 separate shots 21 days apart.
We know it's a 2-dose vaccine, so we want to ensure that we can manage the delivery of the first dose and ensure the delivery of the second dose while we simultaneously integrate new rounds of doses being delivered to the American people.
Are you ready to go if a vaccine is approved tomorrow?
Yes, we are.
What's the first order you're going to give?
It's a simple command of execute. It's a simple command of execute.
So once you say execute, how fast does it get out there?
Within 24 hours.
Do you have doses of vaccine already stockpiled?
Yes, we do.
How many do you have stockpiled?
I'm holding on to that number right now because I want to not create anxiety and we need to work through the details. A month from now, I'll have more.
Operation Warp Speed is also stockpiling kits of the needles, syringes, and alcohol swabs needed to give the shot. The medical distribution company McKesson says it already has produced enough kits for 88 million shots. Kits for 88 million shots.
The idea is the kit will marry up with the vaccine, and they will go together as one package to provide that capability to an administration site.
Are you worried about the security of the stockpiles?
We have taken extraordinary precaution in this area, not only for maybe some nefarious effort, but also natural, hurricane, tornado, etc. Right? It's such a commodity to us. We're taking the full steps to make sure that the vaccine is secure.
Armed guards?
Yes.
Armed guards at sites where the vaccine is stockpiled?
Yes.
Once it starts moving, whether on a truck or a plane, is it going to be under guard?
Yes. That's as far as I'm going to talk about it, though, right? Because you don't want to lay out all the plans, but the answer is yes.
Will you be able to track all the moving parts?
Yes. I feel 100% confident of that.
Will you be able to bang your fist on the table and say what happened to that shipment that was going to Good Samaritan Hospital in Baltimore?
Yes. And not only that, I'll know after it gets there how fast they're administering the doses that they were given.
Perna's ability to do that depends on a software program called Tiberius. Which is supposed to link databases from across the government and the shipping companies into one unified picture that everyone can see.
You can turn on where your hospitals are, where your pharmacies, your nursing homes, and where all of your enrolled providers are inside that jurisdiction.
But when Deacon Maddox, a newly retired Army colonel, briefed Perna on how ready Tiberius is for D-Day,
This capability didn't exist 2 months ago. So there's some things that we need to work through.
Deacon Maddox warned that once the vaccine starts flowing, the amount of data Tiberius has to keep track of will multiply.
What's your worst nightmare?
We get vaccines to the American people and they don't take them. Shame on us. Hey, I was already sick. I don't need it. Shame on us. Hey, I don't believe in vaccines. Shame on us. Just shame on us. And it does keep me up at night.